up with an idea that consists of 3 pieces, and it's called Medical Approach to Recruitment. And the main thing is we have a chair at the person's home and a little chip, which can be inside or maybe just under the skin of the patient, and of course the most important person, the doctor. And of course the most important person is the patient, but we still need the doctor.
Yeah, we thought about this machine mostly for kids and for old people, because they are having trouble. Old people are having trouble remembering what pills to take and what to do, when to measure the blood sugar or whatever. And little kids need more motivation to take pills. So we thought about this chair. So they can sit there, and the chair will measure everything. Those IT people will tell you. And then we have the program will tell you whether you have to take a certain pill or you have to change the pill. And for kids, for example, we have also some gift, like if they do the right thing, if they take the pills, if they let the machine take blood for measuring, then they will see a little cartoon, like 2 minutes maybe, something small, so it won't take too much time before school. And this part you will wear under your skin is just for emergency, like if you are walking somewhere outside where nobody will look after you, whether you're sick or not, and it will measure some electrolytes and some tension in the muscles or in blood, so it will realize if there's something wrong, whether you're fainting or dying, and then it will give an alarm to the chair, and the chair will give the alarm to the doctor. Yeah. And now the solution how it works.
So the device has a main program that is divided into 2 sections, for children and for adults, like older people, because you have to make different options for ones and others, and basically you have different. First of all, you sit, you measure the things you have to measure, and the program tells you what kind of pill you have to take, have you taken them right at a certain time, and when is going to be next time that you have to also come and sit and check. And if the results, it's also show you the results of your measurements. And if results are really bad, then you have option to connect with the doctor right away. And doctor, you can speak about doctor.
There is some kind of a tablet where doctor, there is some other patient, and when patient in here calls the doctor, there came a notification that if it's critical, then he can just switch to the critical patient. And then they can chat through to the camera. There is a camera when the patient sees doctor, and there is a camera where the doctor sees the patient, so they can like a face-to-face connection speaking.
And so that you will always get it right, the program is connected to the chair, and you have a place where it gives you the pill you have to take. So it's really simple and comfortable to use. I think that's it.
Questions for group 3?
Okay. No.
A rather random question, why a chair?
Well, because it's comfortable. For example,
I'm busy, I don't want to sit in a chair.
Well,
Okay, right now I'm sitting.
Well, then again, at first we thought about older people who would like to have a chair, and especially for motivation, in terms of motivation. For example, I think that older people prefer to, let's go and sit, it's so comfy. It also can have options like massage or something to motivate even more.
For older people, can you vary the type of chair? Because I know my grandfather loves a rocking chair. For instance.
They can even have the one that puts you free. The side and here.
So there are different models.
Yeah, of course.
Now-
This
now
one
it
is
comes
actually
to-
Mati 750, so we have different.
Now it comes really tricky. What about people in a wheelchair?
Well, they are connected. They come with their wheelchair and they connect themselves to the screen and maybe other devices. We haven't done this true, but it's an option that you connect yourself with your wheelchair, and it also can do all the options that normal chair would do.
What about traveling? Do you have to take the chair with you? It's
No,
a little bit tricky.
No, but because there's a beamer inside for the medication, because medication changes from time to time, so the beamer is here in the arm rest. So there is actually a bigger beamer for traveling. So you just put in which country, what time.
And I can already see buses and airplanes equipped with these chairs.
Can you pass the airport security with the chair?
Yes. it's totally good for X-ray, and also it doesn't have any magnetic stuff, so it won't be a problem. Okay.
But the real important question, will doctors have green hair in the future?
Yeah, because we are cool punk doctors.
But is it funded by the government, or do the patients have to buy it? It's cost expensive. System?
We're getting
It's funded by a group because it's we have a website on the internet, and and there's lots of doctors and IT people working together, and because so many people like that, they all donate like €5 or something, how much they want to give, and this sums up. So that's why we've got the money for it.
Okay, thank you.